Hi, my name is Siwan Kaur. I'm a second-year internal medicine resident at Michigan State University. Today, I'll be presenting a case of deceitful culprit for pseudohypothyroidism. Biotin, also known as vitamin B7, is a water-soluble vitamin which is taken for a variety of proposed health benefits. Majority of people get sufficient biotin from a well-balanced diet, and a daily adequate intake for biotin is approximately 30 micrograms per day. Multivitamins typically contains anywhere from 30 to 300 micrograms of biotin, while the supplements sold for skin, hair, and nail usually range from 5,000 to 10,000 micrograms. High-dose biotin is marketed as a meme to improve hair and skin health and is widely available over the counter. With the increased use of over-the-counter supplements, biotin interference with common lab immunoassay has been increasingly being recognized. Hereby, we report a case of biotin-induced pseudohypothyroidism. An 82-year-old female with no significant past medical history presented with sudden onset palpitation for a day. Upon presentation, she was found to be in atrial fibrillation with rapid ventricular response. Initial labs were remarkable for a low TSH of 0.97, elevated free T4 of 1.59, and a free T3 of 3.2. Thus, an initial diagnosis of hyperthyroidism was made. However, further history later revealed that the patient has been taking 10 milligrams of biotin daily for the past 2 years. She was then advised to stop taking biotin temporarily. Repeated thyroid function tests 48 hours after discontinuation of biotin shows a TSH of 2.56, free T4 of 1.48, and a free T3 of 3.1, and repeated tests 72 hours later shows normalization of the thyroid function tests. Thyroid antimicrosomal antibody, thyrotropin receptor antibody, thyroid stimulating immunoglobulin, and anti-thyroglobulin antibody were negative. The final diagnosis of biotin-induced pseudohypothyroidism was eventually made. It has been reported that biotin interferes with chemical assays that measure thyroid function tests. The biotin-streptavidin interaction immunoassay is often used to measure thyroid function tests, thyroid hormones, and thyroid antibodies. The interference occurs through a complex mechanisms of biotin-streptavidin interaction which involve the sandwich and competitive immunoassay. The interference in results include falsely increased T3, T4 using the competitive assay and falsely decreased thyroid stimulating hormone using the sandwich assays, leading to the result of pseudohypothyroidism. Our patient would have been misdiagnosed as true hyperthyroidism, potentially leading to the initiation of treatment for hyperthyroidism, which can cause great harm. Here, we demonstrated the normalization of thyroid function tests after discontinuation of the biotin for 72 hours. In fact, the American Thyroid Association has recommended that patients should stop taking biotin for at least 2 days before taking any thyroid function tests. It is extremely important to take a detailed medication and supplement history given an increased use of over-the-counter supplements. While biotin does not disrupt thyroid function tests itself, it distorts the value that thyroid function assays give, potentially resulting in the misdiagnosis of hyperthyroidism. It is worthwhile to rule out biotin supplementation before making a diagnosis of abnormal thyroid function. Ideally, biotin should be discontinued for at least 48 to 72 hours before checking thyroid function tests. Thank you.